Before us is going to be House File 1810, and I'm going to move that House File 1810 be laid over for possible inclusion in the omnibus tax bill. Welcome to committee. Representative Fisher, please explain your bill.
Thank you, Chair Gomez. Thank you, committee. My bill is a bill that does a couple of things. What it does is in the Human Services Finance Bill, there's dollars that are awarded for workforce development grants. And we're doing a couple of things with that, is making sure that the people who need the grants, these are lower income people, to make sure that they're able to do the work that they need. It's to make sure that people understand that the grants are not to be considered income or assets in determining eligibility. And then also because of that, there's going to be an income tax subtraction for the grants that are received. This is a DHS agency bill to make clarifications to an existing grant program that was passed in 2021. It was called the Home and Community-Based Workforce Development Grant. It was primarily to help grants to direct support professionals who provide supportive services to people with disabilities and older adults. And we're looking at focusing on the part of it that the development grant will be used to provide payments to direct support personnel. These payments are for workers with incomes of 300% of the federal poverty guideline or lower. And I will pause at that point, and I have a person here from the department who can also help answer any questions and provide a little additional information.
Excellent. Welcome to the committee. Please introduce yourself and go ahead with your testimony.
Thank you, Madam Chair. My name is Christy Grom, and I'm with the Department of Human Services. Thanks so much for giving us a little bit of time to talk about this small but important bill. And thank you so much, Representative Fisher, for helping us out with it. So as Representative Fisher mentioned, the 2021 legislature authorized the Home and Community-Based Services, also called HCBS, Workforce Development Grant. And this was part of what was known in 2021 as the HCBS Enhanced FMAP, or Federal Medical Assistance Percentage, which essentially means our federal match that we get on our Medicaid expenditures in Minnesota. And it was related to funding and flexibilities that were created under the American Rescue Plan Act for states to be able to draw down revenues to support their HCBS programs, really enhancing them, growing them, creating innovation. So this is really important funding. We're from the HHS world, and so for those who might be maybe not as familiar with what HCBS means, home and community-based services are for people primarily who are living in their own homes, in their family homes, so children, for example, or adults who might be living in their family home, as well as community-based settings, so things like group homes. They could be provided in places of employment to help people be able to work in school settings. Sometimes you see PCAs even here at the legislature helping people advocate and share their feedback on bills that you're all working on. And so as part of the bill that was passed in 2021, 90% of the funding under these grants had to go directly to people who were direct support professionals. And we wanted to make sure that we were targeting that money in a way that was really meaningful. And so we initially in the bill had the funding targeted for people who were at 200% FPG, Federal Poverty Guideline, or below. We're expanding that a little bit under this bill. And there was just some unintended consequences given that the enhanced HCBS FMAP in 2021 was something that we had to do a little bit at the last minute because we got guidance very late from the federal government. They're not as on top of things as you all are. And so the legislature wanted to be able to make sure we could utilize this revenue. And so they put together a lot of these initiatives, and this was just an oversight that we didn't exclude income. We think it was an unintended consequence. We certainly don't want low-income people having to get, kicked off of their benefits. Some of these folks might be getting child care assistance. They could be getting medical assistance. So we just really want to make this correction, and we hope that you'll support this change. And I'm here to answer any questions if there are any.
Thank you very much, Ms. Grom. Representative Davids.
Thank you, Madam Chair, and I'd like to thank Representative Fisher for bringing this bill forward. I think it's a good bill, and we should all support it.
Excellent. Is there any further discussion to the bill? All right, I'm not seeing any, and Mr. McQuillan and I are going to try not to have PTSD from talking about enhanced HCBS FMAP. We're going to leave that to the Human Services Committee. So with that, thank you so much for being in front of the committee. Do you have any closing comments for us, Representative Fisher?
It's a good bill. Please vote yes. lay it
Excellent.
over.
All right, so I'm going to renew my motion that House File 1810 be laid over for possible inclusion in the omnibus tax bill, and it is laid over.
Thank you.
Thank you very much. Have a good afternoon.